things that we have been talking about in this group has been the outreach for that age 20 to 29 demographic, given that's where we're seeing the most cases go up. So Kelly is actually going to log into the GoToMeeting and share with everyone the media campaign for that group. And then under open discussion, I have from last week, Healthy Sheltering, and Wes Crago and Sarah Nuss from the city of Spokane are going to talk. And does anyone have anything else we need to make sure we touch base on? All right. Well, I will have Steve take it away with numbers.
Fantastic. All right. So things are looking cautiously, optimistically better. For new cases in the past week, we had 215, which is 135 fewer than the previous week, taking our daily average to 31, which was 50 last week. For our 2-week rate per 100,000 newly diagnosed, we are at 109.46, down from 179. We're seeing a pretty steady decline in that number. For new cases by age, the primary age group still is the 20 to 29-year-olds with about 21% of cases. We are seeing fairly significant upticks with those between age 30 and 39. They're at almost 19%, as well as the older population, 70 to 79 and 80 to 89. We're seeing very large increases in caseload there. For our EpiLink, we're at about 77% EpiLinked cases, an increase from 53%, which is great to see. Last week for hospitalizations, we had 15 new hospitalizations, only 17 the previous week. Currently hospitalized in Spokane County, that includes Spokane County residents and other, is 50. We have 32 Spokane residents currently hospitalized. Last week, we had 5 new deaths. And there were 18 deaths the previous week, so there was a large decrease there. Our testing numbers are still delayed quite a bit. We're waiting for the Department of Health to update their metrics. There is kind of a general anecdotal sense that testing has gone down a bit, but we won't know until we get the updated numbers from the Department of Health. For our healthcare system readiness, we have 63.1% of licensed beds currently occupied by patients, of which 3.7 are COVID-19 patients, which is meeting our goal of less than 10%. Last week, our staff internally investigated 196 of the 215 cases, which is a significant increase in how many cases we're doing in-house. A lot of that has to do with the Public Health Institute contract, as well as our new disease investigation specialists. I would say that the margin difference is just the weekend coverage from the Department of Health. We are, right now on the general report, it looks like we're not meeting our case and contact metrics of timeliness, but that has to do with reporting from the new group and trying to get that caught up. We're about a day behind there. Hopefully that'll be in soon. For the care coordination branch, they have reached 286 households to date. They currently have 95 current open cases and 23 cases were closed the previous week. For our business technical advisors working with businesses, so far they have done 1,148 consultations. They completed 56 last week and have done 1,112 total referrals completed. For the unemployment insurance claims, just reviewing this, and this is always about a week behind, we're staying steady at about 1,200 per week, which is significantly lower than our high of about 12,000. The industries most impacted by the unemployment insurance claims are food services and drinking places, specialty trade contractors, and educational services. And then finally, going to our end with high-risk populations, the number of outbreaks in long-term care facilities, we have had 28 to date, and there were 3 new facilities in the previous week. That concludes my data report. Any questions?
So on the COVID activity, It says that we're down from 179.72 a week, and that's 1,260 cases in 1 week. Have we really been at 1,260?
That's for 2 weeks.
Pardon?
That's for 2 weeks.
I'm sorry.
For 2 weeks.
For 2
That
weeks.
metric says for 2 weeks.
Okay.
And that's the rate per 100,000.
Okay. Okay. Thank you.
I believe, yeah, between the two, we're at, what was it last week? 350. Yeah, so 475. So.
Thank you.
I have a question. This is Josh. Last week, some of the media coverage was saying that there was no dip in the amount of testing, and then I've seen sort of the media coverage that came out today that says that's implying that there could be a drop in testing. What has changed in that week time, in that week's period time, to go from there, we're not decreasing the amount of people we're testing to now we are decreasing the amount of people that have been tested?
So from our end, we are still waiting for the update from the Department of Health with their testing metrics. Those come from all the various labs that are throughout the state. So we're waiting for them to get back and collate that information in their new reporting method. So we just haven't seen the data in about 2 weeks, and to this date, it's still not updated on with the Department of Health.
Okay, so we don't know for a fact until we see the numbers if there's actually been a decrease in the amount of testing performed.
Right, that's why I was saying it was really anecdotal that we're getting the perception there has been a decrease in testing, but we won't know until we have the numbers through.
Okay, thank you.
Other questions?
Question on this sheet under case and contact investigations. I'm trying to understand the distinction between number 2 and number 4. The number of cases reached by phone or in person, and the number of contacts reached by phone or in person.
The top one's cases and the other one's contacts. So
So people who've actually got it versus those who've been in contact with those.
correct.
Okay, all right.
Any other questions?
I've got one that might be, well, in the spokesman article, I think it was last week, talked about that when we count our hospitalizations for COVID, there was, at least according to the article, that if you checked in with a broken leg and then you were tested, even though you're asymptomatic and had COVID, it would count on our COVID count for hospitalizations. One, is that accurate? Is that kind of what's going on? And then 2, is that reflected in our numbers right now? Just trying to make sure as we look back over time, are we keeping a consistent way to look at it to know where we're at?
Yes, so we have gone back and changed. We are counting anybody who is currently hospitalized and has tested positive for COVID, regardless of the nature of their hospitalization. The justification for that is that when an individual is hospitalized and tests positive, regardless of why they're there, it requires special activities by the hospital. It requires different staffing, different levels of capacity. And so we're really looking at it as an impact on the system as opposed to the disease activity. We have gone back, we changed that counting on August 1st, and we've gone back and updated that information.
Is that consistent across the state? Everyone's kind of doing that way?
Fairly consistent across the state, yes.
Okay. Thanks.
Steve, I had a question. When the new metrics are released by the Department of Health, is that going to be accompanied by their new calculation strategy? I thought we heard last week that they're kind of changing that if an individual is tested more than once, that is going to then be attributed to our testing amounts versus a discrete person? Or is it going, when the tests are released, is that going to be on the quote old way of counting tests?
Right. So a lot of it's to be seen, and the description online is a little vague, but my impression is what they've changed is that they're going to count all testing as if an individual has been tested 3 or 4 times, they'll still count that as has been tested, but that does not go into the positivity rate. So we'll still not double count the positive rate. but it will show multiple that we've just done several tests in the community. That's just to show really the activity of how they're testing currently. And again, it's more of a systems reflection as opposed to a disease activity reflection.
So Steve, I have one more question. This is Mary Cuny. So with it seeming like testing is down a little bit, could that be because our numbers are down? Because it seems like we're testing people, obviously the hospitals are testing people that are coming in to do any kind of procedure, any of that. But, we're not just doing random testing around the community. So we really seem to be testing people that have been in contact and potentially could be positive. So could that be part of the reason why the testing is down a little bit?
That's probably outside of my expertise to really identify why the testing numbers have gone down. I know Dr. Lutz and I have both been kind of poking around trying to figure out why this number has gone down a little bit. I'll give Dr. Lutz a chance to weigh in on that. So it could be a part of we just have less disease, so less people are being sick, less people are getting tested, but it could also be that the system is testing fewer. We're just not entirely sure yet.
Okay, thank you.
And Dr. Lutz, are you on there? Are you on here now?
Yeah, I am.
Do you have thoughts on that or?
Yes, I think two things along those lines. Yeah, as Steve said earlier, it has been anecdotal that we've seen a decrease in testing that goes back to probably mid-July. In talking with a couple of healthcare partners, their volume of testing has indeed gone down, primarily because they are focusing on symptomatic individuals and those only with contacts rather than more broadly testing. I think the one metric that is of note is that our positivity rate still remains significantly higher than what it should be. So the metric is ideally it's less than 2%. The state metric is less than 5%. I think, Steve, correct me if I'm wrong, but the last time we looked at it, ours was about 14%.
Yeah, we're hovering between 14 and 15 for some time now. It has not changed much over the past month or two.
Okay. So I think that, if you look at disease in the community, that is a metric which is good to take note of, because again, that does demonstrate that, there is still a fair amount of disease out there. So I think the incidence rate that's dropped off so precipitously is a function of less testing. And I think once we get confirmation from different partners and from the state, I think that'll just confirm that for us. The one thing I will say about the drop off in cases, however, is that we did have a really good conversation with one of the researchers from the Institute of Disease Modeling last week. And the one comment that he made that really stood out was that, quote unquote, COVID-19 is exquisitely sensitive to behavior change. And if you look at our slope of our curves, you'll note that after Secretary Weissman's health order and then Governor Inslee's mandate on the 7th, we peaked, plateaued about 2 to 3 weeks after that, probably the latter part of July. And since that time, given what Steve with the survey showed a couple of weeks ago, where mask usage was much better in retail, and again, I think anecdotally we're seeing more of that in the community. You look at our decreases, and I do believe that is a reflection of the fact that people are in those settings wearing, masks more frequently. We still have challenges, however, with gatherings and things, as, for example, happened with that mass gathering on the north side last week. So, I think we still have work to do. And that's where, again, I think the continued encouragement of doing the right thing so that we can open, so that we can get kids back in school is really going to be paramount going forward, especially given that we have, between Labor Day coming up, schools coming back in and things of that. So there's a lot of variables out there that we still have to be cautious about.
And to add to that end, we did complete a masking survey this previous weekend. I'm still waiting for a couple additional surveys to come in. But from what I saw, it was actually well above 90% compliance with mask wearing in those retail spots.
Any other questions on data, or Dr. Lutz, do you have anything else you'd like to talk about this week?
No, nothing at this time, Amelia. Thank you.
Okay. All right, so let's shift over to GSI. Alicia.
Good morning, everybody. Nice to see you. I think just a few, just kind of to keep you apprised of moving pieces. We're in the, this week is the final review week of all of the Open Together small business and nonprofit grants. And so we're still on track to begin funding the first round by the end of next week. So the group's working hard on that. Just related, and Mayor Wick may touch on this as well if he wants, but the City of Spokane Valley Small Business Grant Program opened this week as well. The Greater Spokane Valley Chamber is leading that process, and GSI and Innovia and others are supporting it on the back end as we work for a kind of continuation of coordination across the region for our businesses. And then I'm not sure if Kara mentioned this last week, but we are beginning to fund the other business development organizations that were part of the marketing support fund that was awarded through the CARES Act monies from the county commissioners. So far there are dollars that were pre-approved out to the Greater Spokane Valley Chamber and the Downtown Spokane Partnership that are, and then the West Plains Chamber that are all in process. And this week we'll be finalizing. We have between 8 and 10 other submissions from business districts, PDAs, from the Deer Park Chamber and a few others as they look at some targeted localized marketing support for their business community as part of recovery. And then the other big thing that's rolling out this week is there have been the business toolkits that are part of the Spread Kindness, Not COVID Consumer Confidence campaign have been printed, and those will begin to be distributed to businesses throughout the region over the course of this week and next. So that they have materials available in their facility as part of that coordinated campaign. And then I think the only other thing I would just mention right now, and there's many and some on the phone that are more involved in it, but with the back to school conversation, there is a lot through the Regional Economic and Recovery Task Force, a pretty significant conversation going on around commercial space as an extension for the schools, childcare, to be able to provide additional spaces for support. We saw, and you saw in the Spokesman Review article, just overwhelming response, just even in Spokane Public Schools, from parents needing some kind of care for their kids. So that whole combination of getting workers back to work and supporting them while we're also have school digitally. Big conversation and a really, I think, awesome engagement from the commercial real estate and broker community looking at space that could be repurposed even temporarily for that kind of need. So that conversation has picked up quite a bit over the last couple of weeks. I think those are the main things. I'm happy to answer questions, or if folks have specifics on certain pieces, we can provide more detail, but that's kind of high level what's happening this week.
I have a quick question. And this might be for Alicia, Al, maybe even Jerry. So now that most schools are starting remotely, are there any funds or any funding sources where parents can apply that cannot afford internet service? Or for those parents and families that may be on free or reduced lunches, is there any thought to creating a pool of money to help with internet costs, as the parents really have no choice in the matter?
That's an excellent question, Doug. I haven't heard of anything specific. I'm not sure if others on the call have, but happy to.
I can answer that for SPS. Just being an SPS parent, they are doing not only laptop distribution, but you can submit for broadband connectivity. The way I understand it is it's actually a dedicated Comcast account just for those laptops that can be utilized in case you don't have in-home wireless, or you're at capacity because both parents are on Zoom meetings and the kids have Zoom classes. So I know that for SPS. I don't know that for other districts.
Yeah, I was thinking more like the rural areas where you're really talking about Cougar Broadband or Petra, something like that, that, you know, has a fairly steep monthly rate. I just don't, I worry, like in the Medical Lake School District, I kind of worry about everyone being able to actually afford things. I know the school district set up like 10 Verizon hotspots, but again, you may have to travel to a hotspot and not every parent has a way of traveling. So I don't know if there's someone we can talk to about maybe getting some CARES funding set aside to set up some sort of funding source or application process for people that need help with that, or if that's going to fall on the school district or what. But it might be a good way to use some of the CARES funding, if at all possible, from the county.
So
yes,
Doug,
I love dedicating county funds. So
yeah, Doug, I can, we actually, so Dr. Lutz and I, and Mark and a couple others here at SRHD have a weekly call with superintendents. And I know that, that includes, Deer Park and all, other areas that are probably considered more rural. I would be happy to ask the superintendents what their plan is. I know the different districts have plans for some of those kiddos. So I could find out about that and report back. I know GSI had asked about questions related to commercial space and masks for students. So we did some of that asking. So I could do that on this as well.
Yeah, and
that would be awesome. Please be aware of, the idea of traveling someplace. Not everybody can travel to someplace, to a hotspot, et cetera, because I think that's a response you're probably going to hear. And on the surface, it sounds, we all nod our heads and say that's awesome. But when we think about it, not everybody has that option. Not everybody can travel somewhere, especially with kids. So,
Doug, the other thing I'm going to add, the Department of Commerce has been looking at allocate. They already have and will be allocating more of their funds towards some of the different broadband access pieces, particularly focused for our rural communities. And so I'll follow up with their team if there's anything specific, as particularly, I know everybody's kind of in this scramble as we look at how school is going to be delivered. If there's some specific emphasis or focus or a fund available to what you just mentioned as well. So we'll loop around on that with you.
That would be
Alicia,
awesome.
You might want to reach out to Allison Polson with Better Health Together. She's actually already working on that for a combination of both telehealth and virtual learning. So she might be able to provide a way in for multiple aspects of that, because that's a high focus area for them right now.
Great.
This is Shelley. Doug, I appreciate you bringing this up. We need to recognize that this won't be fixed, though, for this winter. I mean, especially if you look at Eastern Washington. And I think we have to figure out how we're going to have kids. It's one thing to have kids drive to a hotspot right now when the weather's warm, but to think that they're going to sit in their car in December or January to do their homework when they've driven up to a fire station or a library, it's just not, it's not feasible. And so we do have to figure it out both for rural Spokane County and for rural Eastern Washington. And it's not something we're going to fix with broadband this year. Fortunately.
Yep. Commissioner French.
So Doug, Comcast is offering 3 months of free internet service for low-income families and stuff. So that is available. But the issue with broadband and more to the rural areas and stuff, there's nothing that's come to the board with regard to that. We are currently looking at a funding package to help with tuition assistance, if you will, or the registration fees for kids K through 6, I believe, through, the request started with Central Valley and SBS, and now we're looking at conversation with taking countywide to all 17 school districts. So that is on the table, but that's the only request that's come to the board.
Hey, Al, question for you. Is that, my understanding was Comcast provided that as a one-time. So if the parents used it this spring, it's not available anymore. Is that correct?
I don't know that to be, I'm just aware that they were offering the 2-month free, but I don't know when it started and stopped.
Okay, I under the impression it started this spring, so that leaves parents without any opportunities for this fall.
Okay.
And I think with the rural areas, Al, and Shelley, the broadband is there. I know in the Medical Lake School District, there's a couple of providers of broadband. So it's not necessarily getting somebody to provide the service. It's trying to figure out how to get those parents that may not be able to afford it, because the costs are, I just got costs yesterday from one company and it's $180 to install. And then it's like $60 a month. And that's pretty tough, quite honestly. So it's one thing for those communities and rural areas that aren't served to begin with. We're fortunate, I guess, that we are served, and it's just a matter of making sure that all those families can afford it. So I think we can get it tackled earlier, sooner than later. It's just trying to find a funding source. And if it, comes out of each of our communities, CARES money or whatever, that's fine. I just thought I'd bring it up.
Thanks. Thank you. So I want to segue over to Kelly to make sure that you have time to talk about the campaign for 20 to 29-year-olds. So Kelly, do you want to go ahead?
Yes. I just need to be able to share my screen.
We should have a question if there's effectively being a presenter on your screen. I made you a presenter.
It just still says to ask you.
And now?
No.
How about now?
Oh, okay, great. There we go. Yes. Can you all see that?
Yes.
Okay. So just a reminder, last time I spoke to you, I talked about some of our key findings from our research. And some of those messages and images that we came up with was talking to the audience about being candid, about being frank and honest and direct, making sure the audience could recognize themselves. That in our messaging, we recognize their concerns. They don't think masks are easy to wear. They don't like them. That they're messages that are empathetic, compassionate, and self-interested, basically. And also, we want to draw attention to the correct behavior and highlight the positives, highlight where you can wear the mask, and also empower them. How can we empower our young adults during this pandemic? We looked at where we wanted to have these messages, so we cared about where our audience was. So right now, our placements are going to be mostly digital. So we have Instagram stories, Facebook advertising, YouTube advertising, your OTT connected TV streaming, which is your Hulu, your streaming boxes, your HDMI sticks, game consoles, all of that. Snapchat as well. And also we have some Spotify advertising and also some geofencing, which I'm looking at more the geographic targeting so that we can target those college campuses where students are coming back, and also those areas where we tend to see at least gathering being instigated, like popular areas downtown or maybe popular blocks where there's establishments that they like to go to. We picked 5 representatives from our talent pool. And we started out, we'll actually have 2 different series of ads, the first of which are going to be montages. So they're just kind of speaking. It's kind of a way to introduce you to our character, so to speak. And then the second The second set will be scripts like girl talk, having their friends over. How can they do that? How can they be hanging out in the backyard? An outdoor restaurant, going to a skate park, hiking, those things that they want to do. Again, we want to show positive images of them doing the things that they want to be able to do, but how can they do that correctly and help us, keep the numbers down with COVID? And then additional elements, we're working on a website landing page, and that should be completed within the next couple days. We'll be utilizing pixel code on our website so that we'll be able to retarget them if they come to visit. That's when you visit a website and then all of a sudden every time you're on the internet, you see ads for that pair of shoes that you looked at. So they'll be seeing Spokane Regional Health District instead. Our own social media posts. We've had a great community, so there's been some in-kind outreach with billboards and mobile. And since we still are incorporating our brand into these ads to make sure that people know this is the health district, then when you see even some of our more regular advertising, then I think that even the younger generation will recognize that as the health district. So we'll be utilizing those. And then of course, relying on our partners and reaching out to them and seeing how they can help share some of our messaging. So I want to be able to show you the first three. Keep in mind that I think I have to unshare and then share again. Keep in mind that these are 15-second ads when you're working with digital media, so they go really fast. You see the new screen?
Yes.
Okay. I'm going to get this out of my way. Can you hear them?
No.
There we go. It was just taking some time.
Right now, it's tough hanging out with friends. Last thing, just a few of us in one place. How can we hang out? We're supposed to stay apart. It's easy enough to wear hands. It's just what we gotta do for now. We'll make it work.
So that's the first one. Second one. Let me see if I can get this. Sorry, get the sound to work again.
I just want to hang out with my friends, but COVID. They say we're meeting. Actually, I just want this over. Over. I want to live my life. I just want to feel like this.
And the third one.
Just few of us in one place. I just want you with my friends. No, we always do. Wow. Wear our masks. We keep our distance. It's all COVID.
So I don't know for GoToMeeting, it looked like there was a delay here in this room, but I know Kelly and I've seen these multiple times and they don't actually have that delay. So
their mouths match the words.
It all matches. So
hopefully you could hear the messages and what they were saying.
A little bit, yeah. Like they want it to be over. They want to hang out with their friends. All those pieces that are reflective of the data or from their, what they were saying in your research.
Kelly, will these be available to those in the group either via link or through direct contact to you, just for me to record in the minutes?
Yeah, I can share the link to where we have them right now.
Thank you.
And Kelly, do you know when do these start? You mentioned like the Hulu and the HDMI. And
yes, I need an exact date, but I think we just firm confirm them Monday. So it takes 2 to 3 days for things to go live. So we're looking at Friday. By Friday, they'll start seeing them online.
Okay, thank you. Any questions for Kelly? Okay, over for open discussion, Wes, healthy sheltering. I don't know if Sarah's there with you. I don't see her on our screen, but you're muted.
Yeah,
There you go.
there we go.
Okay.
We just want to keep the conversation going that as we look forward into 2021, we continue to we see us doing healthy sheltering or distance sheltering, low capacity sheltering for quite a while into 2021. And that's going to be a financial lift for all of us. It primarily falls within the city of Spokane's burden. And we want to keep the regional effort, at this point, awareness. But as we move closer and we start getting better estimates, we might have real specific requests for going forward with that. Things are, I think, I like the trends and I like kind of what's happening with our sheltering, I'll call it the system within our area. I've had great partnership. The county in particular have really stepped up, and that's been a tremendous aid. But I think we need to kind of keep that conversation going as we go forward. So no formal request right now, just kind of keeping the awareness in front of everyone.
Okay, thank you. Any questions for Wes or additional comments? All right. Anyone have anything else for the meeting that they didn't get in earlier? Commissioner French?
So just for clarification, Wes, are you thinking that there'll be a request of the health district to provide funding, or are you thinking that that's going to be up to the other regional partners?
To be honest, Commissioner, I don't think we've gotten into like who would provide that. It would probably be, we'd talk to all of the partners regionally, whether it's the health district and the county and the valley and everyone as we kind of look at this. I think Tanya's still working on estimates for what that looks like, but there is a high potential for a shortfall in the system next year. And when Tanya gets back, I think we'll have a formal presentation to all of us. Again, I guess what we're picturing, Al, is just that like we have in the past, we would put the facts out there and sit down and with all the smart people on this call, work out a solution together.
So I'm thinking that conversation is probably in a different forum than the health district, because if it comes to the health district, the only jurisdiction that's financing the health district is the county. And that puts all of the burden back on the county and stuff. And I don't know that that's probably where it should be, but we can have that conversation when we get to that point. But I'm thinking it might be a different format than here.
Could be.
Yeah, that was only my only thought was that as well. Like, we're not typically in those conversations at the health district. It's more from recommendations for disease spread and prevention. So, okay. So, next meeting next Tuesday, same time. Unless there are additional questions. Is there anything in the chat, Anne, that I need to?
Kelly.
Oh, okay. It's for Kelly?
Yes.
Oh, okay. Okay. Anything else? Okay, then I think we're adjourned. So next week, Tuesday at 8 a.m. Thank you, everyone.